In this section, we will explore gastroschisis, a congenital anomaly of the anterior abdominal wall. This defect is typically located to the right of the umbilical cord insertion and allows abdominal contents, most commonly the intestines, to herniate directly into the amniotic cavity. Unlike omphalocele, gastroschisis is characterized by the absence of a protective membrane, leaving the herniated organs exposed to the surrounding amniotic fluid, which can cause irritation and other complications. This fundamental difference is crucial for understanding its diagnosis and management. Let's delve deeper into the features and implications of this condition. To understand the development of gastroschisis, it is important to consider its embryological origin. This condition arises due to vascular disruption or failure in closure of the lateral body folds during early fetal development. Unlike omphalocele, the abdominal defect in gastroschisis is not covered by a protective membrane, leaving the herniated intestines directly exposed to the amniotic fluid. This exposure can lead to inflammation, thickening of the bowel wall, and potential functional compromise of the intestines. These pathological changes play a significant role in the challenges encountered during postnatal management. When diagnosing gastroschisis, ultrasound imaging plays a crucial role in distinguishing it from other abdominal wall defects, such as omphalocele. Using 3D ultrasound, we can obtain high resolution surface images that can vividly highlight the herniated bowel loops. This advanced imaging techniques helps confirm the absence of a covering membrane, which is a hallmark of gastroschisis. 4D ultrasound, on the other hand, provides a dynamic, real-time view of the bowel. It allows us to assess critical features such as peristalsis and the presence of complications like volvulus or bowel obstruction. This dynamic evaluation aids in both diagnosis and planning the appropriate management strategy. In such cases, several key features can be identified on ultrasound. The defect is typically small and located to the right of the umbilical cord insertion, often making it easier to differentiate from other abdominal wall defects. Um, you will observe free floating echogenic bowel loops in the amniotic fluid with no covering membrane. This is a distinct characteristic of gastroschisis. Amniotic fluid may appears abnormal, particularly if bowel inflammation is present due to exposure to amniotic fluid. This can also affect the fetal development. Uh, Unlike omphalocele, gastroschisis rarely involves liver herniation or other organs. Uh, the umbilical cord inserts normally into the abdominal wall, separate from the defect, further aiding in distinguishing it from the similar condition. Let's watch this video together. Two common abdominal wall defects that can be identified during fetal imaging. Uh, in gastroschisis, the defect is lateral to the umbilical cord, typically located on the right side. The herniated contacts lack a protective membrane, which differentiates it from omphalocele. The defect is typically smaller and usually involves only the intestines. Uh, uh, Gastroschisis is rarely associated with chromosomal anomalies, while omphalocele defect is in the midline and located at the base of the umbilical cord. The herniated contents are covered by a membrane, differentiating it from gastroschisis. Omphalocele tends to be a larger defect, and liver and other organs may also be involved in the herniated contents. Omphalocele is frequently associated with chromosomal abnormalities and syndromes such as trisomy 13, 18, and 21. These differences are critical for accurate diagnosis and management of the condition. The management and prognosis of gastroschisis. In the prenatal period, prenatal monitoring with serial ultrasounds are essential to monitor the condition of the bowel, uh, monitor fetal growth, and follow up on amniotic fluid levels. Maternal polyhydramnios, which may occur as an excess of amniotic fluid due to impaired swallowing. Uh, delivery planning. In most cases, a vaginal delivery may be possible. However, in more complicated cases, a cesarean section may be recommended. It is crucial for delivery to occur at a tertiary center with neonatal surgical capabilities to ensure immediate care. Postnatal surgery after birth, immediate surgical repair is necessary to close the defect and reposition the intestines into the abdominal cavity. Stage repair may be required in cases of larger herniations or if the bowel is compromised. Uh, Prognosis with timely surgical intervention, the prognosis for isolated gastroschisis is generally favorable. However, complications such as bowel atresia, volvulus, or infection can impact outcomes.